Hi everyone, welcome to my YouTube channel and one of the first in a series of video chats, discussions, interviews with friends and experts of mine on subjects relating to coaching, wellness and well-being for anyone. So today I'm really honored to have a friend and colleague of mine called Dr. Anita talking to me. So I'll just let you introduce yourself if that's all right, Anita.
Hi, Dr. Adam. Congratulations on your launching your YouTube video. And I'm very sure it's going to be very useful. And, the right type of people are definitely going to tune in and hopefully get a lot from these conversations that you're planning to do.
Thank you.
I think it really takes a lot of courage and commitment to get out of kind of a comfort zone, which being physicians does put us into, and trying to create something and continuing to empower ourselves and empower others as well. So yeah, first and foremost, congratulations and all the very best.
Thank you. Thanks so much.
And thanks for reaching out and thanks for having me as your guest on your first episode, which actually feels a lot of, I feel very privileged as well, but it also kind of puts me on a little bit of a stress, but
sorry about that.
Luckily, there isn't anything else to compare with, so I think I'm quite good.
Yeah, no, you're the best one so far, that's for sure.
Yeah.
No, it's all good. No pressure, honestly. Let's just have a nice little chat.
So yeah, where do I, so I'm a retired ENT surgeon. I've had over around 20 years of experience. I majorly practiced in Malaysia, where I was for about, for over 20 years. And then I just moved to New Zealand about 4 or 5 years ago. Had all good intentions and inclinations of requalifying and going back to my surgical days. Yeah. And then, obviously life had other plans for me, to put it in a nutshell. And so today what I'm doing is I'm very privileged because I am my own boss. I run a one-man company. I don't have any other issues that can come along with when you are working, in a company or a hospital or a team, which I think is something which is quite familiar for you as well. Yeah. And most importantly, I am really doing exactly what I really want to do. I think you would relate to the fact that with all due respect to mainstream medicine, there is a certain amount of restriction, and there are certain protocols which are kind of subconsciously that we have to conform to and follow if we want to continue on. What I'm doing now is that I have chosen how I want to still work with other people, help them, empower them, but by integrating more than what was there just in our textbooks. Yeah. And so that's what it is. I am a holistic sleep expert. That's what I call myself. With my ENT, experience, sleep was always something which was of, there was something very fascinating about sleep that I've always had kind of a soft corner for. And so I've done research around sleep and I've had a few publications around sleep as well. And I think the interesting part with sleep is kind of a gray zone because you've got respiratory physicians as well, then you've got sleep physicians as well, and then you've got sleep psychologists, and then you've got the ENT guys who want to just go and cut out what was causing the obstruction. Yeah. But it is so much more than that. It is so much more than that. So that's where my fascination for sleep came across. And then, of course, the beautiful part is when you got to really try and implement all that you've learned in your own life. And I think that's when it really hit me hard last year when I had my own diagnosis. And, I tried, I thought I was doing everything right towards my journey towards my own healing. And, then that's when I realized like sleep was something which seemed to take its own sweet little turn, how it wanted to kind of harass me. Yeah. And that's when my fascination truly came, because I think we learn our lessons, no doubt about it, through our patients and whatever. But I think when you've got to really learn it, when you have to got to literally live it, I think it just gives you an entirely different dimension. Yeah. And so I've been having this kind of, I actually call it a little bit of an affair with sleep because I find it so fascinating.
Love, hate.
Yeah. So yeah, that's a little bit about me. In the meantime, yeah, of course, like you, I I also, became an ICF recognized life coach simply because I was just passionate about it.
Mm,
And again, I would think for us, when we see patients, we want to see them in an entirety versus
mm,
just going in and focusing just, in my case, just in the ear, the nose, or the throat. For me, it always was like, what exactly is happening over here?
yeah, yeah.
And when they come back to us and you tell them, it's stuff like, all right, why aren't you taking these medicines? What can we do? And in a way, I think all of us are kind of inborn coaches once we are physicians.
Yeah, yeah.
It's just like it's kind of giving it a little bit of structure to what
Mm,
we've actually already been doing very, very intuitively.
mm,
So that's how I qualified as a life coach as well. And then it's all these skills that I've kind of put together
yeah,
and worked on myself as well.
yeah, yeah.
And what I am doing for a living.
Yeah, yeah, excellent. Um, so yeah, so you became interested in sleep through your own medical issues,
Yeah.
and can you tell us what you discovered about the importance of sleeping well, and maybe what sleeping well means? Because we all talk about, oh yeah, I slept well last night, or I didn't sleep well last night. Do you have any comments on that?
Sure, absolutely. So what I had, I mean, I was diagnosed with cancer last year, and it was early stage cancer. So, supposedly a prognosis is much better, and things like that.
Mm,
Interestingly, when you are hit with such a diagnosis, you want to do everything possible to make sure that the chances of recurrence are much lesser, and that
mhm.
you really kind of get healed of your first time you had it as well.
Yeah.
So I worked really hard. I did all the works. I went plant-based. I was doing a lot of juicing. I made sure that I was trying to get as much of exercise as possible,
Mm,
with everything. What happened after that, Adam, was I was realizing, like, as part of your cancer treatment, obviously things like fatigue does kick in because I needed radiation as well.
yeah. Yeah.
So after some time, the fatigue really kicks in. And I was realizing, like, by 6 o'clock in the evening, I was like totally exhausted, totally
Mm,
exhausted. And what I started realizing was, like, the nights when I have had a good night of sleep,
mm,
my evening exhaustion was much lesser.
mm,
Which seems to work in a little bit of a contradictory way. You would expect that it's still going to be there, but that's what used to happen.
mm,
And then I just realized, even again, as part of the treatments, you do tend to have, it's part of the treatment, and it's the whole trauma of the diagnosis itself, that
mm,
you become a very let's put it, expressive person, if that's a nice way to put it. And then that's when you realize that there are days when you're a little bit more irritable, you're a little
mhm,
bit more anxious, you're a little bit more sad about your diagnosis, coincidentally, when you may have not slept very well. But on the
mm,
other hand, when I have slept well, I just realized that turning up for my radiation, making my juice, doing my 20 minutes walk, because there was a time when that's all I could manage. I just
yeah.
couldn't even manage even that. But even that seemed to be so much less of an effort.
Mhm,
And most importantly, I was just a better person to be around.
mhm,
I wasn't all cranky and crying and blaming it on my husband and shouting at my kids and stuff like
mm,
that.
mm,
So that's when I really realized, and I said, actually, when you really sit back and think about it, what's going to make me more inclined to, cook healthy for me? What's going to make me get out of bed and really make sure, all right, I try and get that walk, maybe a jog, maybe a little bit
mm,
of yoga. It's I've slept, if I've slept properly,
mhm,
you know so that's when I realized that sleep is really, really our foundation.
yeah.
Although it's considered as one of the pillars, and it kind of comes maybe number 4 or number 5. But I think it's really kind of, a foundation on the basis of which you can turn up better at work. I mean,
Yeah.
basically your sleep is to really help you live better.
Yeah. Yeah.
So, your living or staying awake is actually a comfort, or it's a luxury if you have slept well.
Yeah.
Versus how it has become now. Right now, for most of us, sleep has become a luxury,
Yeah.
whereas that's not the truth. Sleep is the necessity.
Yeah.
Everything else is a luxury.
Yeah. Yeah.
And so
Yeah.
that's where my real interest came in. And as part of all of that, Adam, I had to give up my job. I just couldn't cope with it.
Yeah.
So many things were going on, right? It's just
Yeah.
this whole change that happens in you at every level.
Yeah.
And that's when I realized, I said, if there's one thing that I think that maybe I could really work towards having a better day, whatever
Mm.
is my definition of a better day,
Yeah.
is if I had slept better,
Yeah.
you
Yeah.
know.
Yeah.
And that's when I realized, I said, all right, so the other thing also is you're already on so many medications, you're
Mm.
already under the
Mm.
effect of like radiation in your surgery. And of course, some people need chemo.
Mm.
You don't want to have another additional, supplement to take or a sleeping tablet to take that's going to keep you totally groggy even during the day.
Yeah.
So
Yeah.
that's when I was like, okay, what are the non-pharmacological but evidence-based tools that are actually proven to help and are safe that they can be recommended
Yeah.
for people who may be having a diagnosis of cancer as well? And all these things were things which I could kind of, in a way, kind of experiment maybe a little bit on myself, try and
Mm.
implement. I don't think everything works, obviously,
Mm-hmm.
but the few things that did work, they worked really well. And
Yeah.
now between you and me, I sleep really, really, really well.
Yeah.
I sleep really well, but it takes time
Yeah.
and it takes an ongoing effort, and that's where I think the coaching thing comes in as well.
Yeah.
Versus,
Yeah.
you're given a prescription and you handed down something, you're like, all right, you got to do this. But in coaching, that part is like, all right, what made you like? Why couldn't you do it? Or what
Yeah.
held you back? What do
Yeah.
you know what I mean? So
Yeah.
I think it's a beautiful integration of all of that. That's what I'm doing.
Yeah.
Yeah.
Yeah. So you found it was sort of beneficial to your days, because if you slept well, then you could exercise better the next day, and you had more motivation to kind of do your juicing and cook healthy meals and all this sort of stuff. So the good sleep kind of led on to all the other things being better. Yeah.
Absolutely. Absolutely. I mean, and this is just speaking from a personal experience. I mean, studies obviously already show, when you are sleeping well, first thing, which is so big nowadays, is immunity. Obviously,
Mm-hmm.
your immunity is like so much
Mm.
better.
Yeah.
The other thing which not many people want to address is the whole thing around mental health and
Yeah.
depression. So
Yeah.
obviously, people who don't sleep properly are 5 times more prone to depression.
Yeah.
And
Yeah.
one of the signs of depression again, or the symptoms, is again lack of sleep.
Yeah.
So it kind of becomes like a whole vicious cycle, just going
Yeah.
round and round, round,
Yeah.
And then of course you're talking about big things. You're talking about like cardiac conditions. You're talking about stroke. You're talking about
Mm.
all these big conditions which may actually stem down to a lack of proper sleep, a
Yeah.
good quality of sleep.
Yeah. Yeah.
Interestingly, while I started reading, and this is again something which not many people really mention, but studies have actually shown that certain types of cancer, you can actually be a little bit more predisposed to certain types of cancer if you
Mm.
haven't been sleeping properly. And the
Right.
chances of cancer coming back again or the recurring also has a connection with your sleep.
Oh
So these are
gosh.
really very, very preliminary studies. But when I
Yeah.
read that, I was like, wow. And
Yeah.
as being physicians, how it is during our residency and how stressful our jobs are or
Yeah.
were. So obviously our sleep has obviously taken, a huge backslash from a really long time.
Yeah.
But
Yeah.
yeah, for us to be heroes and to be good physicians, it's taken for granted that you've got to
Yeah.
compromise on sleep.
Yeah. 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 No, no, I
Yeah.
agree. Um, so you've mentioned kind of health benefits, immune system and perhaps types of cancers, cardiovascular disease, and so on, and the kind of just the knock-on effect on your life in general, and you talked about mental health, and which is so important. And I guess you said when you were sleeping better, you were less cranky, maybe less grumpy with your other half and the kids and so on. So even on a sort of a day-to-day level, you're a little bit happier, a little bit more cheerful, maybe, or less grumpy, and so that's all good. And obviously when you're like that, you're just more positive, aren't you? And then that obviously is good for fighting cancer and things like that, being in that kind of mindset. So
Absolutely. The thing about your whole thing around the cancer also is that, why do we go through all the harsh treatments, right?
mm, mm,
You do, end of the day, you want to say, all right, I went through all of that happened on my body or happened in my
mm,
body,
yeah,
because now I really want to start living.
yeah, yeah,
And so part of living is, everybody's definition is different, but it's really
yeah,
about trying to have that joy,
yeah,
um, through whatever
yeah,
circumstances are going to happen. And hey, I'm talking as a cancer survivor, I of
yeah,
all the people know that there is always a chance that it can come back,
yeah,
but I
yeah,
can't be sitting and worrying about it. It's more about
Yeah.
literally like take like every day as it comes.
Yeah.
And
Yeah.
so that whole intention of wanting to have a better life
Yeah.
really starts off actually in your bedroom.
Yeah. 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 So yeah, in a in a non-intimate way, but
Yeah,
yeah.
no pun intended there.
so so basically it's, you know, you recover or you survive from an illness like you've had, or a stroke or a heart attack, and then you want to live well. You don't just want to live or exist, you want to live well. And to do
Yeah.
that, you know, sleeping well is integral to that. Yeah. Okay. All right. And the other thing that just occurred to me is, like, as something that helps you fight these illnesses and recover from these illnesses. And you talked about, you know, not wanting to have, you know, sleeping supplements and medication and so on. It's free, isn't it? You know, you're not having to pay for it. You're not having to, you know, take something that's going to have another effect on your body. It's free of money and free of side effects and
Yeah.
so on. So it's a wonderful thing. So when you say you slept enough, or you slept well, what does that mean for you? I presume that's different for every individual, is it?
Yeah, yeah. So what we really aim, so when we say a good night of sleep, obviously we know about the usual. So we're talking about adults of around our age,
Mm,
because obviously at different ages you've got a different sleep requirement.
yeah.
We're
Yes,
talking
of course.
about, you know, the adult population. We're talking
Mm,
about 7 to 9 hours of sleep, which is supposed to be adequate for us.
mm-hmm.
We can stretch it out a little bit to maybe 6 hours to 10 hours. Uh, Beyond 10 hours also is not good for health. So if
Okay.
you're going to be sleeping too much, that's not too great for health either. And
Mm-hmm.
obviously, if you're going to be sleeping less than 6 hours, and like less than 5 hours is like definitely like a big no-no.
Okay.
So when we're talking about a good quality of sleep, what we are
Mm-hmm.
talking about is um, preferably when you are, so you've got different terms like sleep onset latency, and you've got time in bed, and you've got total sleep time and stuff like that. So I'm
Yeah.
not going to go into the details of all of that, but to put it very simply, our intention is that once your head hits the pillow,
Yeah.
you want to try and be asleep by about 20 minutes to 30 minutes, 15
Mm-hmm.
to 20 minutes. And you want to have an uninterrupted sleep all
Mm-hmm.
the way till the morning.
Mm-hmm.
Even if you do wake up for whatever reason, you should be able to go back to sleep pretty easily.
Yeah.
And
Yeah.
it's really about the duration. And if you're talking about more in terms of how we are kind of monitoring it, then of course, you know, we're talking about the different stages of sleep and things like that.
Yeah.
You know, so the
Yeah.
first half is when you got to go, when you get your really deep sleep, and
Yeah.
then you've got your second half and things like that. So that is
Yeah.
obviously if you're actually being monitored for sleep, but obviously we don't really do it on a normal basis.
Yeah.
It's really about looking not only at the length of your sleep,
Mm.
or rather the duration of your sleep, but it's also about your quality of sleep.
Yeah. Yeah.
So it's really going into the details of all of that. And more importantly, is also how you're feeling during the day.
Mm-hmm.
So some people may be able to sleep only 7 hours, and they are having a perfectly good life during the day, you know, so they
Yeah.
don't have like excessive daytime sleepiness, you
Yeah.
know, they, you know, so different conditions or different situations where they have a chance to fall off to sleep. So
Mm-hmm.
that is like, they're fine, you know, so
Yeah.
this is
Yeah.
really good. So I think a true reflection of a good sleep actually is how your day, is how your following day actually is.
Okay. Yeah.
So
Yeah.
some people may be pretty good even with 6 hours. You know, they're
Yeah.
able to function really well even with 6 hours. Whereas
Yeah.
some people, anything less than 8 to 9 hours, they just can't function normally.
Okay.
So really a reflection is also in your daytime, how you are coping
Okay. Yeah.
daytime as well.
Yeah. Okay.
Yeah.
That's good.
Yeah.
That's good. Um, so I've heard about the links with not sleeping well and being maybe more predisposed to things like Alzheimer's disease, and that during the night when you're asleep, the metabolites that your brain has created during the day by doing its processes get kind of, you know, washed away, cleared away, if you like, dealt with while you're asleep. And I also saw some kind of like a dynamic MRI scan that showed the CSF almost washing over the brain like little waves. And I don't know if that's what's involved in kind of clearing some of these metabolites away.
Absolutely.
Um,
Absolutely. It's, and interestingly, it's the part of the brain which actually deals with the emotions.
mm,
So it's literally like, it's like a whole cleansing is going on. provided we've had like a good quality of sleep as well. So you should have slept at a certain, through a specific stage, if you know what I mean, because you've got like different stages of your sleep. So it should be a particular stage for it to have kind of that whole, it's kind of almost like a whitewashing. It's completely cleanses out the system, which is something that has been proven very, very recently, but it's fascinating. It's really fascinating. So you're getting this whole detox without having to do anything.
And so you need your sort of 7 hours for that process to occur successfully, so the metabolites aren't left there to contribute towards Alzheimer's later on in life and so on. So what happens if your sleep is disturbed? Say you get up to go to the loo or something like that in the night, and you disturb these processes. Does that have any impact?
Yeah. So as I mentioned, if you do need to get up at night for whatever reason, as long as you're able to come back to bed and you're able to go back to sleep, you're good.
Okay.
But ideally, we want to try and even avoid that. So if it is something like something as simple as, all right, you got to go to the washroom, then it's really about thinking, is there any way I could do, or something I could do to prevent me having to even do
not drink late at night and caffeinated drinks and things.
Unless you have a medical condition. But it's really about that as well.
So older men, get your prostate under control, basically. So you're not going to the loo lots of times in the night. Okay, that's great. So are there any kind of major problems that you can think of that can arise from not sleeping enough or sleeping well enough, either acutely or in the long term?
Yeah, it'd be really interesting, Adam, because a lot of my clients, as part of the questionnaires that I run them through, a lot of them have either been diagnosed or they haven't been diagnosed, but they kind of know it at the back of their mind that they already have some amount of anxiety or depression or both happening. That is so much more rampant than people are even aware of. And, that is something which I think is like really, really, really important that we need to address. And when we talk about anxiety or depression, it can lead to a whole lot of other things as well, right? And if it's a physical condition, then it may be a little bit, tad bit easier to manage. Whereas when it goes on to mental health, and there's this whole stigma around it. And let's be honest, when we are going for any kind of a new job as well, when you are applying for it, they ask you, is there any condition over here? Have you ever been diagnosed with something like that? I mean, that is big. Why would you want to do that? So you want to just prevent that, from that happening. So that is something which I've realized happens a lot with people. The other thing also is, of course, with nowadays, for the fact that we are all working from home a lot, people have lost this thing of how to kind of switch off from work and how to actually start having a kind of a winding down routine. So we all have a great morning routine. We have great routines for our kids at night, at time. But then what happens to us? We don't seem to have any kind of a routine. So I think these are all things which we really got to consider back. And when you really think about it, the advantage is that there's so much more that can be done besides medications or anything else that you don't want to do. It's the beauty about sleep is like, even by simple lifestyle changes, you can actually work a lot towards your sleep. And now with everything that's research based, and there's so much of research that's gone into everything, each and everything, we had an amazing time. We had an amazing time where we already have so much of proof of what works and what doesn't work. We've just got to put it out to the public over there, make people more aware about it.
So you've just touched on that then. So what kind of techniques do you advise your clients to use to sleep better and longer?
So typically what I do is, initially I first have my set of questionnaires that I want to make sure what exactly is happening, whether it is like insomnia or whether it is snoring along with insomnia. If it is snoring, then is it obstructive sleep apnea, stuff like that. Because for me, every person is so different and there's so many factors that could be contributing towards it. So I can't just kind of get a group of 10 people and say, all right, everybody come and I'm going to help you with your sleep. That's almost impossible. It has to be a bespoke, tailored program for each and every person. So that's the first thing that I do. And to be honest, if I feel that the person is, say, having really having signs of, say, anxiety or depression, which is beyond my scope, because
Yeah.
I'm not trying to replace a therapist or a counselor or even a psychologist or
Hmm.
like psychiatrist, then I have to know that, all right, this is somebody who, just by giving my so-called techniques, it's not going to benefit so much, because maybe this person actually really needs a little bit more of a, intensive
Yeah.
treatment. So at the end of my questionnaires, I kind of decide a plan, and I get an idea of how much I can do, if they need to be referred to somebody else, and what has to be done, and how I can
Hmm.
do it. So I've got my own referral partners as well that I,
Hmm.
refer them to. And so once I'm kind of quite clear cut and I feel, all right, so this is something that I can, one of the tools that I have, or I can use, is something that, would help this person. One of the things that I use is, so you're aware of cognitive behavioral therapy for insomnia,
Hmm.
CBTI. So that, of course, is one of the ones which have been highly, highly studied, and it's even been studied for people who've had cancer as well, to really help us with our insomnia-related issues. And the
Yeah.
effect of CBTI is actually even beyond about at least 6 months, and it can even be
Hmm.
for a much longer time. And by 6 months, you are a much better, you're in a much better space as well.
Yeah.
So
Yeah.
CBTI is very, very effective. Now, to really do CBTI, obviously you need like a special qualification. But what I do is I do something which is called a brief behavioral therapy. So
Hmm.
CBTI is something for which you require at least about 8 to 10 sessions.
Hmm.
And when you're talking about these kind of sessions, and obviously the cost factor does kick in at some
Hmm.
point.
Yeah. Yeah.
Whereas what happens with behavioral therapy is I do it in about 3 or 4 sessions. It
Hmm.
actually can be done in 2 sessions, but I don't like to rush my clients.
Yeah.
I like to kind of have an idea on their progress as well. And because it's not just doing the BBTI part of it, it's really about doing the coaching aspect of it as well, and finding out what worked and what didn't work.
Hmm.
So that's where I do that as well. It's something which is kind of relatively new, but
Yeah.
I can do it in about 4 sessions. But what I do beyond that also is really looking into the other aspects that may be affecting their sleep, like exercise. So everybody's got this huge thing about exercise. Oh, you should not be exercising within 3 or 4 hours of going to sleep.
Yeah.
Now, how many people actually know that a little bit of light exercise within 3 or 4 hours actually helps you sleep better?
Yeah. Yeah. Not me. Yeah.
You know,
Yeah. I
yeah.
got in
So
my
that is
head
something.
that, it stimulates you,
Yeah.
your pulse is going, you're sweating,
Yeah.
you go and have a shower afterwards, that wakes you up even more. Yeah.
Yeah.
Okay.
We're not talking about the hardcore
Yeah.
exercise, working out in the gym kind of thing, but we're talking about like maybe like a gentle walk or even like a gentle jog and stuff like that.
Yeah.
But things like that actually help. So these are all small but very, very significant things that can actually help you towards your sleep. So when I go through what's happening, I go into details of how many coffees have you had, for
Yeah.
example.
Yeah.
I know everybody knows that dark chocolate is healthy,
Yeah.
but do people actually know that dark chocolate also contains caffeine? And so it's
No.
really about,
It's
yeah.
amazing. Thank you.
So it's really about looking into that aspect of it, and then of course the
Mm,
exercise, the diet, and
mm,
there's this other part of sleep which is also pretty phenomenal, which is really, it's kind of really a reflection of a little bit of your subconscious stuff as well.
mm.
So you may be doing everything correctly, and still there are times when at 3 a.m. you are awake thinking about God only knows what.
Yeah.
So you're
Yeah.
worrying about something. Again,
Yeah.
it doesn't necessarily have to be only cancer,
Mm.
but it can be anybody else who over here doesn't have a worry. So you're either at
Yes. Yeah.
some point, either you're worrying about your future or
Mm.
you're ruminating about your past.
Yeah.
So one of my most favorite tools that I actually help people with is how to cope better around these worries. So it's not
Yeah.
like pushing them away and meditating or anything like that. It's really about looking it in his face and saying, okay, what can I do about this? So that
Yeah.
is another
Yeah.
tool as well that is really, really helpful.
Yeah.
And so these are some of the things. And of course, your whole thing about your sleep hygiene. The other part that I do also is what we call a sleep restriction therapy, because sometimes people are in bed for too long, because
Yeah.
most people are
Yeah.
we have the belief that if we are spending more time in bed, that means we are going to be sleeping for longer, but it
Mm.
really doesn't work that way.
Mm. Mm.
So I have people who come with their 7-day sleep diary, and they're like spending 10 hours on bed,
Mm.
whereas they're actually able to sleep only for 7 hours.
Yeah.
So it's
Yeah.
kind of really trying to restrict that as well. So it's a lot of mix along with all these things. And as this is just what I mentioned, what I can remember of, offhand.
Yeah. Yeah.
Uh, so everybody's just so unique. Everybody
Yeah.
requires different help, but there's all these stuff, and all these things are they're non-pharmacological.
Yeah.
B, you can't really go wrong with it. But again, as I mentioned, if it is someone whom I feel really requires some more kind of immediate attention,
Yeah.
definitely I refer to them. If it is somebody who's having sleepers, severe sleep apnea, like, so that's where my ENT part comes in as well, where I would be able to diagnose them having mild, moderate, or severe,
Yeah. Yeah.
apnea. Then I know, hey, just by my-based therapy, it's not going to help. This guy actually maybe needs a CPAP. Maybe he needs to see an ENT specialist who can
Yeah.
do an endoscopy and stuff like that. So it's
Sure.
really about seeing, and that's what. So my first 1 or 2 sessions is really about getting to know what exactly is happening better. And
Yeah.
then I
Yeah.
compile everything together. And then the second or the third session is where I say, all right, this is what we can start off with.
Yeah.
And I'm not going to tell you like 10 things, like I'm not going to give you 10 tablets or 10 things on the prescription. I'm
Yeah.
going to just give 2 or 3, and I'm going to follow up with you and see how it goes. And then if you haven't done it, then I'm going to keep you accountable as to why you haven't been able to do it. So
Yeah. Yeah.
that's how it is. That's how it works.
Yeah. That's good. That's good. Just a few things arising out of what you've just said, just so that people, perhaps kind of who aren't doctors who are watching this and so on, will understand. So my understanding, and I only learned this myself a few years ago, which I'm a bit ashamed of, but don't mind admitting. As a doctor, I probably should have known this a long time before. But so the half-life of caffeine is 12 hours. Is that correct?
No, its half-life is 6 hours.
Its half-life is 6 hours. Okay, I've heard 12. Okay, so but the half-life concept is just for people that don't understand. So if you let's go on the 6 hours because you're the expert. If you have a coffee at then say 3 p.m., then half of the dose of that caffeine that you ingested at 3 p.m. is still in your system at 9 p.m.
Yeah.
And then at 3 a.m., 6 hours later, half of that again is still in your system. So it just goes, the amount of caffeine in your system goes down a lot more slowly than people think, essentially.
Yeah, absolutely. And what happens is, even if you have your first cup, say at 9 o'clock, and then you have your second cup at your 12 o'clock, so you already have the caffeine there, and the 12 o'clock part is keeping it up. And then when you want to have the 3 o'clock, after a nice lunch, and you're like, oh, I still haven't finished at work, but I still have to, stay awake. And that's when you want to do that 3 o'clock, 2 o'clock, the mid-afternoon slump. But you're just adding up your caffeine, you're adding up your caffeine, you're adding up your caffeine.
Because at 3
Having
p.m.
said that, it's not really all wrong. Yeah, it's not all wrong. So one thing which of course you can easily replace is just by going and doing a decaf. So you still feel like you are having, your coffee fix, but without necessarily having so much. And that's, we're just talking about coffee. We don't consider all this secret stuff. So people are so much into herbal teas. How many of us actually know that even many of the herbal teas also do contain caffeine? So it's all these small little things that we have to, and that's what I really go in detail about. It's literally, all right, what do you eat? What do you drink? Okay, how many times? Alcohol, we didn't touch on alcohol. That's big. People love to have alcohol. They're like, oh, after a glass, we like totally knocked out. Great, it helps you to sleep, but it's really not only about your length of your sleep, it's also about your quality of sleep. So it's really about re-educating people, showing them studies that really have shown that what this actually is how it is, without just kind of putting them into a space of fear. Because again, for me, I think it's interesting because we've got to balance it out. You tell somebody, especially over here with winter, you tell them, well, you got to cut off your coffee, you can't have your dark chocolate, you can't have your wine. They're going to be like, okay, that's like
that's my life.
3/4 of my life.
What's life worth living for then?
Exactly.
Yeah.
So kind of going a little bit slowly and trying to maybe modify a little bit. But what's beautiful is once you start doing the work, you can actually start seeing how it's actually, you're just feeling better. And you obviously are the person to judge what works for you. And then, of course, they are usually very, very, they're very good clients. Let's put it that way.
No, that's good. Thank you. And I think you mentioned meditation. Is meditation and yoga and mindfulness, can that help with your sleep in the long term, or even in the short term?
So definitely, especially when we're talking about mindfulness, and especially when we're talking about MBSR, which is mindfulness-based stress reduction, that is definitely being studied to actually cope with stress, even around people who've had cancer.
Okay.
So that is definitely something that really helps.
Yeah.
Um, and in terms of yoga, yes, I totally get it.
Hmm.
Again, we have to be a little bit mindful because yoga, you've got different types of yoga. So you can have
Yeah.
very kind of vigorous yoga as well.
Hmm.
Compared to kind of a restorative or a yin yoga, which is more relaxing.
Yeah.
So you really need to know what's going to actually support you as well.
Okay. Yeah.
End of the day, it's like we can kind of recommend, but I really believe that it's also about getting people back in touch with their own intuition,
Yeah.
because let's be honest, nobody knows. We know our bodies best,
Yeah. Yeah.
so for me, I may know that, all right, I can't do that form of yoga because it's keeping me awake, but for somebody else, it may be working great.
Sure.
Um,
Yeah.
Similarly, mindfulness, interesting you brought that up, because yes, it was just one of my clients yesterday, and I was telling her, well, because her stress levels were like really high. She's the
Mm.
medical person as well. So I said, well, maybe you could try and work around mindfulness. And she was like, well, yeah, I have tried it before, but it didn't really work. But what
Mm.
really works for me is when I'm out there, I love getting my jogs, or I love going for a swim. So she's more of an active
Hmm.
person. She relaxes through activity.
Yeah.
And that's when I really loved it, because I said, great, if you're finding that relaxing, end of the day, the goal is for you to relax and reach that stage where you can kind of slide into sleep.
Yeah. Yeah.
Whether it means that swim, or whether it means mindfulness. So how does she know, right? She knows because she knows what's best for her.
Yeah. Trial and error. Yeah. Yeah.
Trial and error,
Yeah.
so it's really, really, really interesting. But there
Yeah.
are people who have never been, and most of us have never really been in tune with our own body's needs.
Yeah.
And so it's a matter of giving them a lot of options and then letting them try, but also the options which are evidence based.
Yeah.
Sadly, there's just so much of stuff out there in the market. Um, Having gone through cancer myself, it's quite sad to see how people are trying to make money even when you're going through something like this, by
Yeah.
kind of claiming magic potions. This works,
Yeah.
this works. So you know, I think that's when, really, honestly, I think that was the time when I was the most grateful for having been a medical person, because
Yeah.
I knew exactly what to look up on Google. I don't
Yeah.
have anything against Google, but you need to know what to Google and what to
Yes.
just keep away from,
Yes. Yeah.
and
Yeah.
that's exactly what I hope for my clients as well. If
Yeah.
someone comes with me and says, hey, what about this? And I tell them, listen, I have no clue about this, but I'm going to look it up and I'm going to get back to you regarding this, because
Yeah.
I know what to look up,
Yeah. Yeah.
and I think that's where we are at a huge advantage as well.
Yeah. Yeah. No, true. Very true. Um, one more thing that you mentioned before was about diet and the effect of what you eat on
Mhm.
your sleep. I've heard you talk
Yeah.
before about having heavy meals late at night and getting gastric reflux and things like that, and obviously that adversely affecting your sleep. Is that the main example, or are there any other examples of how diet can
Well,
affect your sleep?
definitely. I mean, we don't really recommend to have like a very heavy meal just before you're going to sleep.
Mm.
But having said that, studies do show that a little bit of carbs actually helps you to sleep better.
Okay.
Go against.
Is that refined or unrefined? Just so that I know
Yeah.
for 10, 11 o'clock
Well,
tonight.
yeah, well, it's about all these things that we've grown up and we fear. It's like, oh my God, I need to have my last meal by 8 o'clock, by 6 o'clock. If not,
Yeah.
I'm going to get obese and stuff like that. But a little bit of carbs, and it can be in the
Mm.
form of like even fruits. So obviously, we're talking
Okay.
about
Yeah.
like healthy stuff. So,
Yeah. Fruit
you
sugars and
know,
things. Yeah.
yeah, that actually definitely helps as well. And there's some, there are a lot of specific things like your fruits, your nuts, stuff like that, which really have the right ingredients that are actually going to
Yeah.
help you sleep better as well.
Excellent.
It's a matter of us deciding what we want to have.
Yeah. Yeah.
Like we are in New Zealand, and so
Yeah.
fruit actually suppose has been studied to actually help you sleep better. So it's one of the few things which have actually been studied to actually sleep better, help you sleep better.
Excellent.
And we are in the best.
I'm going to go and grab some this afternoon then. um,
Yeah.
how about a little daytime nap, a little siesta? It's supposed to be good
Yeah.
for you, isn't it? How does that help, and how
Yeah.
long would you recommend? If you can,
Yeah.
obviously.
Well,
Not.
it is good. Yeah, it is good if you really need to, first and foremost.
Hmm.
And secondly, it's called a power nap for a reason. It's not something that you go to bed and you appear out of bed like after 2 hours.
Yeah.
It can be for like maybe 10 20 minutes max. You don't
Yeah.
want to be napping for more than 20 minutes,
Yeah.
because then what happens is that kind of eats into your
Yeah.
nighttime sleep.
Yeah.
And your real restorative sleep, where we were talking about earlier, where everything happens, the cleansing happens, is your nighttime sleep.
Yes.
So
Yeah.
you want to try and really maximize out that.
Yeah.
But if you really feel to need that, need to feel that nap, have
Yeah.
the nap, then you can have about 10-15 minutes, but you've got
Hmm.
to be up after 15 to 20 minutes, because
Okay.
beyond that, it's going to go and going to start affecting your nighttime sleep. And you don't
Okay.
want that to happen.
Okay.
Yeah.
And what is the is there a specific benefit to having a nap? Is it just if you feel tired, you have 15
Well,
minutes
yeah,
and then that just
yeah.
stops you from feeling tired, essentially?
Yeah, I mean, it's basically because if you are so sleep deprived at night, you may
Yeah.
have a chance in the afternoon, especially after you've had a meal and things like that,
Yeah.
where you may be tempted to catch a nap. And there's nothing
Okay.
wrong about that, because
Okay.
it's really your body trying to tell you that you aren't
Yeah.
sleeping enough.
Yeah. Yeah.
Like I can have an afternoon nap every single day if I wanted to, but I
Yeah.
don't, because my body doesn't
Yeah.
ask for it, because my
Yeah.
nighttime sleep is good enough.
Yeah.
But when the body is trying to say, all right, you need to get a little bit of rest, then
Yeah.
listen to your body. But
Yeah.
having said that, we're not talking about a long time. You want it
Yeah.
to be much more. So, and usually 10 to 20 minutes actually is sufficient. So
Yeah.
it doesn't have to go beyond that.
Yeah.
So yeah, yeah.
Okay. So as you say, it's not restorative sleep. It doesn't contribute towards the good things that your nighttime sleep does. But if your concentration has gone off a little bit because you're tired, or your attention span, it just kind of brings that back into line for the
Yes.
rest of the day, sort of thing. Perfect. Perfect. That is fantastic. That's such amazing information there. Thank you. Unless there's anything else you wanted to say, I was just going to close now by inviting you to tell us how we can contact you, or follow you on social media, what things you're going to be up to in the coming months.
Yeah. Yeah. So it's all a work in progress, obviously. And then you put up a website, and then a few months later you go there and you're like, oh my God, is that seriously a website? Like,
At least you have one. Mine is still a work in progress.
well, so right now mine is work in progress as well. So it's just like, mine, but that's how it is, right? It's kind of, you get your message a little bit more clearer, what you want to really portray,
Yeah.
what information you want to put out there. So yeah, so right now my website is kind of under renovation. But I'm quite active on Instagram, and of course my LinkedIn as well.
Mm-hmm.
And I do have a Facebook page too. So I've kind of kept it kind of uniform. So it's called All About Sleep, whether it's my Instagram or my Facebook. I'll be happy to share, the handles and the links to it later.
Excellent. Yeah.
And I don't want to confuse people, but I do realize that not everybody's on LinkedIn, but also not everybody's on Instagram.
Yeah.
So
Yeah.
that's why it's really nice to have different options.
Yeah.
And what am I doing? So as I mentioned, for me, really, really, Alex, is like, um, at the end of the sessions that I've had with each and every client, when they say, oh my God, like they've never slept so well, that just feels like so, so, so good.
Yeah.
They
Yeah.
have gone through a nightmare or whatever it may be, and they're feeling so much more better.
Yeah.
So what for me, my ideal thing is really, I like to work one-on-one.
Mm-hmm.
Having said that, I do understand with a one-on-one, although between you and me, it's not like I charge the ridiculously high amount of money that some people can be charging.
Yeah. Yeah.
I don't go anywhere near that, because it's just not fair. I think it's just not fair. But yes, there has to be a little bit of a money exchange as well. But I do agree, and I do understand, especially having gone through cancer myself. I do understand that a lot of us are financially a little bit more threatened.
Mm-hmm.
So that's when I kind of when I came into this thing, which is, what I want to call it kind of a group program. It's a 7S strategy, where I'm really talking each month. So it's going to be over 7 months, hoping to start it in July. And every month I'm going to be talking about different aspects. So of course, we're going to be talking about sleep, exercise, and all of that. But I'm also going to be talking about other things like, what's your vision for life? So I start off with that. What is the vision that you want to create for your life? And we're talking about you. We're not talking about what your husband wants for you, or what your child wants for you, or what the society expects of you. It's really what you really want. And that's how it starts. 1 month I actually even cover about money and finances. And in fact, that's one of the few things that I start off very early on, because you have to get that out of your system and saying, realizing that, you know what, actually, maybe I can afford to continue to invest in my life.
Yeah. Yeah.
So money is so big. Studies actually show, especially like for cancer people, that compared to a fear of recurrence, the fear of your financial future keeps you actually more awake at night.
Yeah.
Can you
Yeah.
imagine that?
Gosh.
You know,
Yeah.
so you want to address that as well. And then you've got your exercise and, things like that. And then my last part module, which I cover, is a little bit around the little bit of a deeper healing that each of us are forced to have as a part of healing.
Mm.
Your whole thing around a little bit around maybe spirituality, a little bit about, because I think eventually the question does arise in you, hey, why did that even happen to me? I'm a classic example. I thought I was leading a good life, healthy life,
Mm.
doing the right things and everything, no family history, nothing. And suddenly, boom, you're given a
Yeah.
diagnosis like this, and you
Yeah.
sit back and you're like, hang on, everybody at home's having KFC and they are perfectly healthy, and
Yeah.
here I'm doing the meditation, the yoga and everything. And like, what happened? What
Yeah.
happened
Yeah.
there? So you really have to kind of start getting some kind of peace
Yeah.
in the midst of the uncertainty and
Yeah.
acceptance that you may not be able to get the answers to your most important questions.
Yeah.
And
Yeah.
you're just got to be fine and you've got to be happy in spite of it. So that actually is kind of my last module, because it's not about religion, but it's really
Mm.
about giving you small little tools that are going to kind of maybe help you to deal and cope with the rest of your life
Yeah.
better.
Yeah.
So honestly, Adam, I think what I have done is really put everything together that's really helped me on my healing journey.
Yeah.
uh,
Yeah.
to where I am. Like today, I'm like just a year since finishing my treatment,
Yeah.
and my life is just totally changed. It's totally
Yeah.
changed, and
Yeah.
this is
Yeah.
my vision I have for everybody who would want to come and whom I could contribute and whom I could serve.
Yeah. Yeah. That sounds amazing. It's a very holistic program by the
Yes.
sounds of it. It's kind of quite coaching based by the sounds of it.
Yeah.
It's not all about sleep. It's about other things as well. But it obviously the ultimate benefit is on your sleep, which will have a knock on effect on the other
Yeah.
aspects of your life. So that's
And yeah, that's a
fantastic.
good point you brought up actually, because every month I will be releasing one module, but besides that, I'm also going to be having 2 live coaching sessions every
Hmm.
month.
Hmm.
So depending on the different time zones, because again, as I mentioned, one thing is kind of bombarding somebody and saying, all right, you need to do this,
Hmm.
and then you got to follow up with them and then kind of maybe coach them or help
Yeah.
them or
Yeah.
you know
Yeah.
whatever, push them or
Yeah.
do whatever you need to do to make sure they do it. And that's
Yeah.
why I want to do it over 7 months. Most people like to do it in like 21 days and like 6 weeks and all of that.
Yeah.
I'm like, listen, what happens on day 22? What happens in week 7? You go back to almost the same how you were
Yeah. Yeah.
before.
Yeah.
When you're doing it over a more prolonged time, it's literally like an entirely new lifestyle.
Yeah.
So it's not necessary you should have had a diagnosis of cancer or something. Although cancer really, really brings you to your knees, but
Yeah.
but besides that, it's really about modifying and continuing on.
Yeah.
And it's going to be around December and January as well, which is the time
Yeah.
when most of us totally forget about
Yeah.
all the good work we've done.
Fall off the wagon. Yeah.
Christmas, New
Yeah.
Year. So I'm still going to be hounding you in January.
Yeah.
And
Yeah.
then, once you're done with that, then yeah, it's going to be 2022.
That's good. That's really good. Yeah. Yeah. It takes, as you say, I think I've had at least 6 months for behaviors to change. So a 6 week, intensive program is not useful. But
Yeah.
that's really good. And the is it online modules that your clients will be doing, or will they be doing group sessions as well?
Yeah.
And will the 2 live coaching sessions be group or individual?
Yeah, so there are different packages depending on what people can actually afford, to be
Yeah.
honest.
Yeah.
So if there are people who want just the modules, again, the modules are going to be released online. So they
Yeah.
have access to it. They can watch it according to what time zone,
Yeah.
what suits them.
Yeah.
And so
Perfect.
that would be one package. Then the one which is got along with the live sessions, then that's a different package.
Yeah.
And so I also have an additional kind of an exclusive package where they would have a one what people, I won't say can afford. I would say what people are willing to invest in their health and in
Yeah.
their
Yeah.
life.
Yeah. 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 Yeah.
Yeah.
Yeah.
So that's pretty much the way that I've done it. And I mean, I have my what do I call a premium clients as well, where I really make it a very luxurious experience as well. So I
Yeah,
literally go
yeah,
into the nitty-gritties and find out, is your bed, is it comfortable? Is your pillow comfortable?
yeah,
Are we
yeah,
making it conducive enough? Are we
yeah,
sure about your food? So it's literally like it's like I'm doing an entire lifestyle change for
yeah,
them. But those are my premium clients, and obviously
yeah,
costs much more. But so it really depends on what people want to and
yeah,
what they can
yeah, yeah,
and
yeah.
spend.
Lovely,
Yeah.
lovely. Um, yeah, no, that sounds great. That sounds really personal. I like that, the pillows and the mattress and all of that. That's, yeah, that's
Yeah.
great
I
detail
mean,
to.
honestly, I'm thinking of
Yeah.
putting my tagline, and I would love to hear what you have to say, but I'm thinking of putting my tagline on my website as like, let's make sleep sexy again. It's just like everyone's just made everything so serious. But let's be
Yeah,
honest, our
yeah,
bed is for like two things. It's for sleep and for intimacy.
yeah,
Why are we taking the fun out of everything in life?
yeah, yeah,
So I'm
yeah,
very tempted, but I don't know how that's going to go down.
yeah.
But yeah, it has to be something that's fun as well, and it makes you feel good
Exactly.
as well.
Exactly.
Yeah.
Yeah. Yeah.
Yeah.
Totally. Yeah. No, I agree. I agree. Um, Perfect. So just about your contacts then. So you said all about sleep is your handle for all of your social medias. Yeah. And people can send you messages through Instagram and so on. Yeah.
Yeah.
Yeah. Perfect. And
Yes,
LinkedIn, you're
that's right.
also
That's
Dr. Anita Ranganathan as well, aren't you, on LinkedIn?
right. Dr. Anita R. Yeah, it's
Yeah.
Dr. Anita
Dr.
R. Yeah,
Okay.
that's
Cool.
right.
Perfect. Lovely. Was there anything you wanted to say to close?
Um, no, it's been great, Adam. Thank you very much. I hope I have been able to pretty much be of some use. People are going to benefit from hearing this. I think there were a lot of kind of small little points that I have put in as part of, through while we were talking, although I may have made it sound very casual. But honestly, I think I've given away a lot of stuff that I actually do
Yeah.
for real.
Yeah. Yeah.
And yeah, I
That's
just,
great.
I just want people to reach out. There's so many ways that I can actually help, and it's way beyond what you and I could be covering within like 20
Yeah,
minutes
of
to 30
course.
minutes.
Of
There's just
course.
so much more.
Yeah, yeah.
Don't neglect your sleep. Don't neglect your health, because God forbid anybody has to learn the lesson the way I had to.
Yeah, yeah, yeah. Thank you so much. That's
Yeah,
wonderful.
yeah.
It's going to be of huge
Thank
value
you.
to your followers and mine. So I will share this with you, and you share your social media handles with me, and I'll put that on the channel, the write up
Sure.
as well. All right.
Thank you.
Superb. Enjoy the rest of your day.
Thank you. Thanks,
Cheers.
Adam.
Bye.
Cheers.
Bye.